So the first topic that I wanted to cover today was about vasectomies. Somebody had asked me about doing a vasectomy for a dog as opposed to a regular castration. And I also received another question in my inbox that is slightly relevant to that. So I will do them back to back. First of all, a vasectomy for a dog is you could say that it's less invasive because it involves taking less tissue away and it leaves some organs intact, most organs intact, in fact. If you don't know where that word vasectomy comes from, ectomy just means taking away, and the vas refers to the vas deferens, which is the duct or the tube that leads from a dog's um, testicle to the outside so that the sperm can be delivered to the female. Apart from leaving some organs intact and taking less tissue, it's probably just about as invasive because it does require that dogs be put under a general anesthetic. So there's that. Since there's a little less cutting involved, there might be less pain afterwards. I don't know, that's a little speculative on my part. But a couple things that I found out about it that really don't have anything to do with RMF or natural hygiene are that it might be hard to find a vet who does this because they usually do the regular castration type of neutering, and they might not even be familiar with the procedure. It involves learning a new procedure. And it will, maybe for that reason, I don't know if there's another reason, it will typically cost about 30% more. A couple of other things about it. It doesn't make the dog sterile right away. That takes about 2 months, and I've heard some people say that it's best to keep newly neutered dogs away from females for 3 months just to be safe. After a dog has had a vasectomy, they can still have sex, but they will just fire blanks. They will not be able to get another dog pregnant. And apparently there's a worry in the human world that vasectomies reverse themselves. And I think that probably does happen sometimes, but I saw a statistic that said 1 in 2,000. So it's actually pretty rare for this duct to heal itself and become functional again. But so in the meantime, vasectomies do not change the behavior of the dog. They still will go crazy. They still will, when there's a female in heat around, they will still try to get to the dog, and they will still be able to have sex, as I said. And they retain their hormones, which is a good thing, of course. That's the part that we want to keep. That's the good thing. Hi, Joy. Thanks for coming. Oh, we got a bunch of watchers already. Be sure to comment if you guys have any questions. Okay, so I wanted to read from this website that I found was pretty helpful on the subject of vasectomy, and it's called Veterinary Village. It's a small animal clinic, apparently, but they are specializing in vasectomy over neutering. Surgery will be performed by our vets who have many years of surgical experience. So these are people who do this all the time, apparently, as opposed to regular neutering. Vasectomy removes part of the vas deferens, the cord that travels from the testicles to the outside. It leaves the testicles intact. Hormones are maintained, and the dog is not fertile. What are the advantages and this is the part that I wanted to talk to you guys about. What are the advantages of retaining the testes? Lower incidence of cancer, lower of a certain kind of cancer, hemangiosarcoma, lower incidence of osteosarcoma, lower risk of transitional cell carcinoma, lower risk of prostatic adenocarcinoma, lower incidence of obesity. So those first four that I just read are not valid at all, because cancer can be entirely prevented with proper feeding. It has nothing to do if they have seen an increase in cancer in dogs that have undergone or that have not undergone one or the other forms of sterilization, then there are other things that account for that, not the fact that the organs are still there. I mean, a dog is not going to be getting cancer in organs that are not there. So apparently bone cancer, bladder cancer, cancers found in the spleen or heart have been found to be higher in dogs that are not neutered. But we have to go, just wait a second. And this is where our critical thinking skills come in handy, because we don't see dogs out in the wild getting cancer, and it's not because they don't live long enough, because they do. 7 to 9 years is the average age of a wolf, and that is plenty of time to develop cancer, and they all retain their organs, all of them. So that comes from not understanding, pretending to not understand. Who knows? The medical industry has to have some notion that there is a big environmental component in the development of cancer. And as I've said before, the biggest environmental component in cancer is the part of it that goes in your mouth or your dog's mouth. So that's something that we can do something about right from the get-go. The lower incidence of obesity might have something valid to it. I don't know. Reduced incidence of hip dysplasia, reduced incidence of cranial cruciate rupture. Those are good things. Those are valid things, probably related to the retention of hormones. Lower incidence of adverse reactions to vaccines. That's interesting. I hadn't read that. Lower incidence of adverse reactions to vaccines is seen in dogs that are neutered. I can't explain that one. I think that's kind of a hit and miss. I don't know. I'd have to see the studies that have been done that have established that. Behavioral advantages to dogs that have been neutered: decreased incidence of cognitive dysfunction, less fearfulness, noise phobias. That's probably hormonal. What are the disadvantages of retaining the testes? Increased risk of, so this is the same thing, increased risk of testicular cancer. So you're not going to get testicular cancer if you don't have any testicles, right? Risk of unwanted pregnancies if a vasectomy is not performed. An increased risk of prostatitis, benign prostatic hyperplasia, prostatic cysts, and squamous metaplasia of the prostate. Well, same thing. We don't have to wonder what something called prostatitis is caused by, because we know that anything that ends with itis means inflammation. It's just inflammation. What causes inflammation? When there is healing to be done in a certain area and the body, for some reason, has deposited wastes there. And in order to get rid of those wastes and make the healing possible in that area, the body has to bring in fluids to dilute the wastes, and it also brings in heat to accelerate this whole process of getting rid of the wastes. And that's called inflammation. It's very simple. There's a very simple answer to it. It's not the big enemy of all mammals on Earth, like the medical industry would like us to think. It's a very simple thing. It's a life-saving thing. It's something the body does on purpose. We don't have to fight the body. We just need to understand it and figure out what the body is doing and take away its reasons for doing that. That's what natural hygiene is all about. That's what RMF is all about.